Hi, everybody. Welcome to the program today. We're really glad that all of you can join us. I'm Karen Umamoto from the UCLA Asian American Studies Center, and this program is being co-sponsored by the LA County Department of Public Health, the Fielding School of Public Health, and the Asian Pacific Policy and Planning Council. We always like to start our programs with a land acknowledgements to pay tribute to the Tongva peoples upon whose land we reside, which is the LA County and Channel Islands, as we strive to be better stewards of the land of the indigenous peoples. While people are filing in, we're going to show a short 3-minute video. It's one of many resources that we have online at our COVID-19 Multilingual Resource Hub, which we'll share more about in the program.
What is social distancing? Social distancing is sometimes called physical distancing. It means having enough space between you and other people to reduce the spread of COVID-19. Why should I practice social distancing? Some people who have the virus don't feel or look sick, and they can spread the virus without knowing it. If someone has coronavirus, they can spray the virus into the air from their lungs by coughing, singing, sneezing, or just talking. The closer you get to that person, the more likely you are to get sick. Stay a safe distance from other people, even when you are wearing a mask. When do I practice social distancing? Practice social distancing anytime you are around other people who do not live in your household. This includes going out to work, to shop, to exercise, and to school. Practice social distancing when you visit family and friends, or while talking with your neighbor outside. This might feel awkward at first, but this is one way to show that you care. How do I practice social distancing? Stay at home when you can. Stay connected by phone or online instead of in person. Avoid crowded spaces. If you must go out, whether to shop, work, or exercise, remember to keep a safe distance from others. Most doctors have recommended that you stay at least 6 feet or 2 meters away from other people. But newer research shows that the coronavirus can travel over 25 feet. So stay as far apart from others as much as possible, especially when you're indoors. Spread the word. Wash your hands, wear a mask, and practice social distancing. Spread the word, and not the virus. Based on scientific knowledge as of August 2020, the most common way to get the coronavirus is by breathing in respiratory droplets of those infected with COVID-19. Another common way of getting the virus is by touching your nose, eyes, or mouth after touching an item or surface contaminated by the virus. To protect yourself and others, wear a mask or face covering, wash your hands, keep a safe distance from others you don't live with.
Welcome, everyone. Can everyone hear me okay? So as we come into the room, can you please in the chat, we'd love to know who is attending this webinar today. If you could leave your name, your title, and organization, that would be great. So good afternoon, everyone. Thank you for being here today. My name is Jocelyn Estiondon, and I'm the Senior Public Health Analyst with the Los Angeles County Department of Public Health. Welcome to Translating COVID-19, a webinar on resources for Asian American, Native Hawaiian, and Pacific Islander communities. What you just saw, if you weren't here at the very beginning, is a video that was produced in a partnership between UCLA Asian American Studies Center and the Fielding School of Public Health, and it's one of the many resources we'll be sharing with you today. I'd like for you to see our agenda. We wanted this to be pretty informal time together where we'll talk a little bit up front, but then open it up for feedback and questions and answers at the end. My colleagues at UCLA Asian American Studies Center and Fielding School of Public Health will do an overview of translatecovid.org, an amazing repository of translated COVID materials that is searchable by language. I will share the process in which a dedicated group of community organizations and UCLA, which I think you guys are a community-based organization to me, and our department developed a COVID-19 educational material with universal messages that I think resonate across all of our Asian communities. And then you'll briefly hear about the work that's happening on the ground in terms of COVID-19 outreach from our partners at APCON. And finally, we'd like to engage you all in some feedback. We'd love to hear from you in our, that will inform our next steps forward, especially as the vaccination rollout has already started in LA County, and how important, the messaging of vaccination will be and is. But before we get started, I'd like to get to know who is with us today. And my colleague Melissa will be putting up some questions for you. We'd love to get 100% response rate. So I'll stop sharing my screen. And Melissa, if you could help put up the Slidos. So the first question, for those of you who are not familiar with Slido, if you have a smartphone handy, and in most phones, you could just open up your camera and point your camera to the QR code on your screen. It'll take you directly to this poll question. If you don't want to use your phone, or if it doesn't have that feature, then you could just go ahead and open up another tab in your browser and type in slido.com. And on the very top box where it says joining as a participant, put in that first number 24316. And then you'll see the selections there. So we would love to know what sector you're from, who's joining us today. You guys can see here, looks like a lot of nonprofits, which is great. Colleges and universities, healthcare. It's fluctuating. I'm just going to give this maybe another minute to give folks some time to vote. Great. Wonderful. We have so far 28. It looks like a lot of nonprofits, second, colleges and universities. I know there's also nonprofit healthcare, so I know you have to choose. Some government folks, some education. Wonderful. So I think predominantly we have a big nonprofit group here. So thank you again for joining us. Okay, let's go to the next question. So for this question, in your work and your interactions with community members, what type of information is most needed for translation? So this one, it will result in a word cloud. So one word responses or very short phrases are actually ideal for this. But please let us know, what type of information do you think is most needed for translation in our Asian American, Native Hawaiian, and Pacific Islander languages? So this could be like mask wearing, physical distancing, vaccine FAQ, gatherings, where the gatherings are really what's driving our surge right now. How to gather safely, great. Lots on vaccines, gatherings, testing options. How to get free COVID testing, the safety of vaccines. This is great. Keep it coming, please. 100% response rate is what all of the researchers are looking for. Accurate health, birthing and lactation. Great. Yes, I mean, I know we're all about COVID right now, but please give us all the information that you have, that you're representing your communities with. Holiday travel, great. Disaggregated Asian American, Native Hawaiian, Pacific Islander data. Economic resources. Anything COVID-19. looks like vaccine is winning out. Certainly, that's on everyone's minds. Accurate health. What else? Myth busting. Absolutely. Wonderful. Healthy coping. Yes, a very huge mental health component now. Mental health wellness. I'm seeing that now too. Great. Wonderful. Thank you so much. This is very, very helpful. Okay, Melissa, let's go to the third one. And then finally, what languages are spoken by the clients that you serve? Now, if there are multiple languages, please enter them one at a time so that it doesn't cluster. Just one language, and then you have the option to enter another response. We'll give folks a moment to adjust and go to the next Slido number. Great. Japanese, Korean starts standing out here. Chinese, Thai, Mandarin, Vietnamese, over 20 languages, thank you. Tongan, good. Khmer, Japanese. I'll just give it another maybe 30 seconds. With these word clouds, you know, I think you're all familiar with word clouds now. The more repetitive or the same responses get a bigger space on the cloud. Spanish, absolutely. Thai, Tagalog. Wonderful. All right. Thank you so much. This is great. Thank you for participating. It really helps us get a feel for, you know, who's out there serving our communities. Again, we'll have a little time later on to do a little feedback and Q&A session, but now I'd like to pass it over to Karen Umamoto, the director of the Asian American Studies Center at UCLA. She and others will be giving an overview of translatecovid.org.
Thank you, Jocelyn. And thanks everybody for joining us today. We'll be spending about 10 minutes to demo the COVID-19 Multilingual Resource Hub and share our vetting process with you. This website is a joint project between the UCLA Asian American Studies Center and Professors May Wang and Gilbert G, representing the Fielding School of Public Health. When the pandemic hit last winter, we all saw a need for in-language resources to slow the spread of the virus. And based on all of our commitments to serving our communities, we quickly shifted our resources and attention as the campus was shutting down last winter and created this website from many different resources gathered by students and staff in an easy to use interface. So we also produced a series of videos. So that's what we started with, is one of our videos. We did 3, one on mask wearing, social distancing, and hand washing, and have those fully translated in 6 languages, including Korean, Vietnamese, and Spanish, which were big letters on the screen in the cloud, in the word cloud. With 6 more languages on its way, including Marshallese and Chuukese. Now the task before us is to spread the word about this resource so more people can actually use it. So we really thank you for being here to learn about it. Before I pass the baton to Daniel, who's going to take us through the demo, I'd just like to mention that in addition to the 3 of us faculty, this was really a grand effort by so many people who did this in addition to their normal duties. And I'd just like to acknowledge the Asian American Studies Center staff, led by Tom Wen, along with a crew of student assistants, staff, interns, a video team led by Janet Chen and filmmaker Duc Nguyen, and the translation firm of UCLA alumnus Brian Fukuma, called eWeb Translators, and donors to our crowdfunding campaign for the videos. So it's been a labor of love, and we hope this resources resource will be useful to all of you and the families you serve. So let me turn it over now to Daniel.
Thank you, Karen. My name is Daniel, and I'm one of the programmers involved in the development of transitcovid.org. And I'll be walking through some of the core functions of the website. And I'm excited to show you how we have made available an entire database of COVID-19 resources in over 50 languages. And we hope that you find the interface simple and intuitive to navigate as you try to deliver content that is easily accessible for our communities. As you scroll down the landing page, you'll see a search bar, which serves as the core mechanism of finding relevant resources. Then, we have several cards which point to the key topics in the fight to contain the spread of COVID-19. And we've also made videos about these topics, one of which you saw at the beginning of this webinar. These set of videos are original content produced by and in partnership with the UCLA Asian American Studies Center and the Fielding School of Public Health. And they're currently available in 7 different languages and are designed to target both the diverse and at-risk communities that we serve here in Los Angeles. Scrolling back up to the top, we are able to search for resources on COVID-19 by topics, languages, and keywords. So for example, I could search for something about how to be safe. I'll hit search. And we have 562 resources on how to be safe in all languages. So naturally, when I filter by our native language, I happen to speak Korean. So I can either scroll down to this list or type in Korean. And this field also accepts special characters. So if you know how to type in your native language, this also works. Hit enter. And now I have 22 resources on how to be safe, all in Korean. I'd like to narrow down the search a little bit further and look for something maybe regarding prevention. And there we are. I'd like to take a moment to just draw your attention to how we've chosen to do the layout of the information on this page. On the right-hand side, you'll find icons that give us a hint to the type of resource we can expect when we click on these links. Is it a video? Is it a website? Or is it some kind of an infographic? And on the left, you'll find the source, and also what we like to call paired resources. That means that an English version of the translated material will almost always be available. And this becomes much more relevant as we start talking about advanced or complex issues that some of us might have difficulty translating, especially if you aren't experts in the field or if you just don't possess the level of vocabulary necessary to effectively translate the material for our loved ones. So in my case, I could show my parents who don't speak English very well the Korean version of the resource. And I could read the English one knowing that we'd be on the same page. And we believe that this methodology really helps bridge any language and generational barriers when it comes to educating the public across all age groups about the fundamentals of this pandemic. And it's a key feature we've implemented across all of our database resources. So for example, our video section also shares the same exact functionality. Here we have a collection of videos that have been embedded in many different languages, and they serve to communicate important stories, concepts, and ideas about COVID-19 in engaging and meaningful ways. One important point I'd like to make is that we can implement different ways to group and filter through our database. For example, by clicking on one of these cards on the landing page, reveals a layout that is organized to allow our users to filter through the content with the sidebar. We are essentially leveraging the ability to tag each of these resources to make this happen, and our team is currently adding even more descriptive metadata in an effort to help you find information that you care about even more quickly. And it helps to know that the entire website was built ground up to deliver a great user experience across all screen sizes, including mobile devices. Now, I think that covers most of the information about querying our database for resources, but we're continually expanding on the number of languages, features, and types of information that we hope to be helpful to our communities. That brings us to the menu options on our navigation. And I'd like to take a brief moment to go through these tabs as well. Learn and share, Resource Center, and anti-hate links give us curated information from trusted sources throughout the web, all in one convenient location. For example, in Learn and Share, You'll find frequently asked questions about COVID-19 from the CDC in several different languages, real-world data analytics related to COVID-19, and also a social media toolkit that we created that allows anyone to download and utilize to spread the word about transitcovid.org. Our resource center provides useful information about local COVID-19 resources, and I'd like to highlight findhelp.org, which allows our communities to connect with social care providers using just a zip code, and it gives us access to food, housing, employment resources, and much more. We've also listed links here for major health agencies and organizations for their response to COVID-19 in many different languages. And you can also see what the UC campuses, UCLA, Fielding School of Public Health, and UCLA Health are all doing on the COVID front. Last but not least, in response to the increasing number of hate crimes against immigrants and targeted racist incidents in the wake of the COVID-19 pandemic, we've aggregated resources to help report hate crimes in various languages, and even resources to help visualize where hate crimes are happening in the United States with a hate crime map. So this just concludes the brief demo of our website. And as you continue to grow, we encourage you to just visit our site and try for yourselves. We welcome all feedback as we continue our efforts to make translated resources more accessible to our communities. Thank you. And with that, I'd like to turn it over to Dr. Wang, who had a big part in vetting all of the resources that you'll see here on transitcovid.org.
Good afternoon, everyone, and thank you, Daniel. I think as Karen mentioned earlier, this is truly has been a labor of love, and we couldn't have done it without all of the dedication and volunteer time that everyone has put into this. And with our limited resources, we really wanted to try to make sure that the materials that we share are relevant and up to date. And because we cannot possibly vet through every single material that we find, we came up with a vetting protocol. And with this vetting protocol, we came up with a decision tree and to ask some questions to kind of guide our student volunteers who have been helping us vet these materials. So we started by asking the question, is the source credible? And if it is credible, and by credible, we mean sources such as CDC, the LA Department of Public Health, and other government agencies, as well as academic institutions, then the next question we ask is the content likely to change? For example, information about what the coronavirus is, that's unlikely to change, information about where to get a COVID test, etc., that might change very, very rapidly. So if that's the case, then we ask the question, if somebody were to act on the information and it is not the most up-to-date, would it inconvenience them? And if it does inconvenience them, we actually don't include the information just because we don't want people to take action on information that might be just a tad bit out of date, but it would still inconvenience them. And then, we also, now for materials that are not from a credible source, we ask the question, are the materials providing, very similar information from credible sources? And if they are, we don't include those materials. But if they aren't in that particular language especially, then we ask that same question, is the information the content likely to change? If yes, we exclude it. But if not, then we ask, is the English version accurate? And if it is yes, we include. And if it's not, we exclude. We are trying to expand our pool of student volunteers who are bilingual so that if there are materials that are not available in English and are relevant and helpful, we actually would have someone who can review that. But if we don't, for now, we don't include those materials. So I think that's all I wanted to share with everyone on how we review and vet our materials. So thank you.
Thank you, May. I'm going to go into my section now. So in this part of the agenda, I'd like to share the collective effort of several community partners who helped develop a one-page front and back COVID-19 infographic and resource page for our Asian American communities. To give a little bit of background on how this all got started, the AA NHPI, Asian American Native Hawaiian Pacific Islander COVID-19 Task Force was formed from the AANHPI Health Initiative at the time. It was this same group of stakeholders who decided to pivot and focus collective efforts to address the COVID-19 pandemic as we saw the emerging needs of our Asian American community. Our group is one of 4 subcommittees that were formed at the time. The other 3 are data and information disaggregation, road to recovery and policy, and resources and funding. The task force wrote a letter to the DPH health officer with a number of asks, but the first of which was to improve accessibility, outreach, and translation of COVID-19 materials and information for AA and HPI communities. And so this is what this group seeks to do, this subcommittee. I do want to recognize that while Native Hawaiian and Pacific Islanders are included in this goal, this subcommittee really just focused on Asian American communities because there was already a lot of great communications efforts coming out of the Southern California Pacific Islander COVID response team. And they were actually way ahead of us, in fact. So materials were developed for the NHPI communities, but it wasn't directly from this committee. And here on this next slide, there are representatives from each of the agencies listed here on the subcommittee. One of the ways the group thought to improve accessibility, outreach, and translation of COVID-19 materials was to develop our own material that addressed the specific needs of our communities. So I conducted key informant interviews with community partners. This was back in April and May. I brought back the information to the subcommittee and the group agreed upon our messaging. It was sent to our communications team who developed the look and feel, like our DPH look and feel, and we decided to translate the materials into the LA County Asian threshold languages that are listed here. So here's the front page of the infographic. From the key informant interviews, we tried to hone in on messages that would remain relevant for the duration of the pandemic. And so you'll see here at the very top, reminders of how to stop the spread of COVID-19. In this section over here, we really encourage people to seek timely care. We heard at the time that many people in our communities were very afraid to go to their doctor's office or even call 911 to go to the emergency room because they were afraid to contract COVID-19 if they were to do that. So there was a lot of delay in care. In this section here, we wanted to address misinformation and culture-specific norms. So we were hearing from our community that they were getting information from social media, a lot of misinformation about how there were cures and herbs that could cure COVID-19 or prevent COVID-19. So we want to make sure that people got the right information from reliable resources and to also avoid scams. A lot of scams are continuing to happen even now, people trying to take advantage of this pandemic. So we do have links there, and so the links are live when you receive the information via PDF, but we try to do like a short URL here so that people can easily type it into their browser. And then this last section here is really an encouragement to maintain regular preventative care. Again, same thing. We were really hearing that parents were afraid to take their children to their pediatrician to get the regular shots. And so we are actually seeing a decrease in a lot of these preventative shots for kids. So we wanted to make sure that people know that their doctor's office are trying their best to keep their area safe for them to take their kids in for their preventative care. On the back side of this resource, we decided to list community resources linking folks to the services that you see here. We decided as a group to also list community-based organizations information after getting their permission, of course, alongside these public agencies who provide the same service, but they focus and serve our Asian community and have the language capacity, the staff who speak those languages at each of these agencies. So just a little bit about the development process of this resource. When possible, we tried to partner with the Asian American agencies who translate the infographic. And these were vendors who are already on the DPH Translation Master Agreement list. In addition to the vendor's review process, the translated docs were then sent to community partners for their review to ensure suitability and readability in the community. The feedback was given back to the vendor to make changes. The final review was then conducted by DPH and our community partners. And then our communications team posted the infographics online. And I should add here that it's not the usual process that we go through with document translation at DPH. Typically, our materials are sent to the vendor. They do their own review, adjustment process, and then we're given back the final product. But for this process and this material in particular, we wanted to ensure the translations were accurately conveying the message to our target audience, which were the under-resourced Asian community members in LA County. And I would be remiss if I didn't highlight the parallel efforts that took place for the Native Hawaiian and Pacific Islander communities. Scott Chan, my colleague here at DPH, couldn't be here today, but he worked with the SoCal Pacific Islander COVID-19 response team to develop this fact sheet. And I'm going to go through very quickly on how you can find these materials online. So I'm going to actually click on the link, and it'll take you to our DPH website. And it's kind of hard to navigate, to be honest, and that's why I wanted to take you through it here today. So this is the landing page. When you go to public health, this is what you'll see. It's this first link here. And then you would scroll down to a section called Guidance IMA. And the section is Individual, Family, and Specific Group. So you click on that, it's a bookmark to further down on the page. Well, you see other materials as well, but here, if you see infographic, Cambodian communities infographic, Chinese, Filipino, Japanese, Korean, South Asian, Vietnamese. Actually, we actually do have Thai. Oh, there we go, Thai. And similar to how Daniel was saying on translatecovid.org, having the English alongside with the translated material is really important. So we have both of those as well. So you can see from just scrolling through our website that many of our materials are also translated already into Asian languages. It's just that you have to know in English what you're looking for, and then see whether or not that material is available in that translated language. So we did try to work with our communications team on having direct links to pages that are fully translated. And I'm happy to say that this just got online yesterday. These are pilot pages specifically for the Korean community. We have simplified Chinese, traditional Chinese, and Spanish. So these are kind of pilot pages, but if you, I'm going to click on Korean, and you'll see that the entire page is in Korean. The drop downs, all of the available resources are in language. So for those of you who work with the Korean community, you would just have to send this link to them if they are looking for just specifically Korean material. And same with, I'll click on traditional Chinese. So here's so we're still working on where from our main site it'll link to this. So you guys have, like, I guess, insider information. We're posting the links in the chat so that you can have them. They're live online, but we just don't have a link from our main page yet to these pages quite yet. I mentioned earlier that the communication efforts of the SoCal Pacific Islander COVID-19 response team, I would love for you to check out their website. They also have in-language materials, including this amazing COVID-19 community toolkit and a lot more. And I'll show you a little bit later on how you can access this toolkit online. also available is the social media toolkits that the county has produced. So I'm going to quickly go over here. We're going to go to the County of LA's COVID website. And where to find this toolkit is under this resource tab here. If you hover over it, this little pop down comes in and it's Community Toolkit. And here you'll see the different infographics, motion graphics with translated versions of all the materials. Now this is the website, and we actually have the back end. There's a Google Excel sheet that is also available that I could not find on their website, but I wanted to, Melissa, if you could share that link. It's this website here that I'm going to share with you right now. It's this COVID-19 social media toolkit in which the county, so this is the Joint Information Center, kind of the hub of all of the emergency response at the county level, and their communications team from the office of the CEO. They have all of these resources online that are available for your own personal social media, for your organization's social media. If it would be great if we all had one, message, with all of these. They're already translated into the threshold language. All you have to do is copy and paste the graphic into your social media account and then copy the text here. So there's many tabs at the bottom, as you could see. I'm at the Multicultural Toolkit tab down here. And as I mentioned, there's also the Native Hawaiian Pacific Islander Toolkit, and you can also find that here. So here we have resources translated in Tongan. There's videos, a lot of great content, Samoan, Chamorro, it was Marshallese, and then Hawaiian at the very end. So there's a lot of great social media messaging graphics that you could just grab and copy and paste and put into your own social media handles. So this is the Pacific Islander. I just wanted to say that all these wonderful people made all of these efforts possible. Each person here contributed, whether it was to review a translation or connect me to someone who could review a translation, or help vet an organization, or dial a phone number to make sure someone on the other line is speaking the language that they're supposed to speak. And so I think really the network that has emerged from these efforts are key in continued work and collaboration in the future. So I thank every single one of these people, and I apologize if I missed anyone. I dug through my emails and tried to include everyone who was a part of this great effort. And for future opportunities with our subcommittee, we really wanted to look at how to collaborate to create relevant messaging for our communities. We want to develop an online hub to house links not only to materials, but to resources as well. There are great, ethnic-specific resources that a lot of people may not know about that are out there that we would love to be able to share in one place, so that you could just go to one place and you have links to all of these great resources. Further building of relationship and partnerships, which I'm also always grateful for, and then the promotion of the COVID-19 vaccine, which is, I think, what we're going to be focusing on, and what we'll be talking about a little bit later. So with that, I would like to introduce Manju Kulkarni, who is the Executive Director of APCON, one of our partners, and she's going to tell us a little bit about what's happening on the ground with regard to COVID-19 outreach.
Thank you, Jocelyn. Good afternoon, everyone. It's a privilege to join you all today and to be a partner really with Translate COVID-19 and all the wonderful folks at UCLA. I'm especially pleased to be part of this effort because as you can see, one of the inaugural founders of the project is one of our member organizations, Asian American Studies Center at UCLA. It's been a delight to work with Melanie and Karen and so many other folks that are part of the center. And so it's great to be with you today and have already learned so much, even though I've been aware of the website since its founding. So I've been asked to share a little bit of information about the Equity Fund. This is a joint project of LA County Department of Public Health and the Department of Health Services, and is a project really to help slow the spread in disproportionately impacted communities and to reduce the impact of COVID-19 in what are those marginalized communities. So the project and the fund provides resources to 51 community-based organizations, and we are very proud at APCON to be one of those grantees. For folks who don't know, APCON is a coalition of over 40 community-based organizations that together serve and represent the 1.5 million Asian Americans and Pacific Islanders in Los Angeles County. And so alongside a number of our member organizations, including Chinatown Service Center, Khmer Girls in Action, Little Tokyo Service Center, Sahas for Cause, and also collaborative partners at Care Clinic, Herald Christian, PWC or Filipino Worker Center, the Nail Salon Collaborative, and of course, Southern California Pacific Islander Response Team. We have really been tasked to do what is such important work in AAPI communities alongside those others who are working in communities of color. And what the project has done, or what they've chosen to do with this, is using the organizations that have long-standing histories of fighting for healthcare access in marginalized communities in Los Angeles. And so they've gone to the CBOs as trusted messengers. We have cultural and linguistic expertise that we bring to bear to this work, and are certainly aided by the Translate COVID-19 website. So in terms of some of that work specifically too, it's also serving as a bridge with those elected officials and other policymakers in understanding communities of color. And when I talk about specifically the AAPI community in this regard, you know, we have that understanding of where our communities live. We know that they often live multi-generationally in high density housing where they work. So many are essential workers in our healthcare field, also in the meatpacking industry and other arenas. And also understanding where we frequent, whether that be on social media or those ethnic markets where many of our members are going. And what is so critical too for this work is building on our existing work and existing partnerships. And so I'm so glad to also share with you that we have been part of the community health worker outreach initiative that is funded by the county alongside California Community Foundation, doing it this work since October, with 14 community-based organizations that are part of our collaborative, and with the leadership of Myron Dean Kwan at Napa Fossa and Dorina Wong and Leslie Toy at Asian Resources Inc., who are really providing that substantive direction for this project. And in terms of the work that we are actually doing, it's outreach and engagement to raise awareness about how to prevent the spread of the disease, navigating systems, including how to connect with healthcare, with social services, with testing. And then a number of groups are also doing contact tracing. The last thing I want to mention too is that, you know, part of our overall work also is about ensuring equity with the distribution of the vaccine. And so I'm proud to say that we are also on the DPH Vaccine Equity Committee, sharing the expertise that we bring to bear, but also the experiences of our community members and our community-based organizations in this work. And so it's so important to have Translate COVID resources available to those workers out in the field and also to all of our community members. So I just want to thank everyone on this call who was part of that because it's really such a critical resource. Thank you.
Thanks so much, Manju. I'm going to share my screen again. And this is the part of the webinar where we would love to get your feedback. We want to open it up to Q&A a little bit later, but before we do that, I want to invite our other panelists here, Dr. Karen Umamoto, Dr. Mei Wang, and also Dr. Gilbert G. from UCLA. He's a professor at the UCLA Fielding School of Public Health, and Manju, come back, Manju. We're going to answer your questions that you have, but before we answer your questions, we would love for you to answer ours. So the first question, and if you could leave it in the chat. So there's Q&A for your questions, but if you could leave your answers in the chat so that we will be able to record it a little bit later, that would be fantastic. This first question is, how might you be able to use the resources that you saw today in your work? And if you have any, constructive criticism, what improvements can be made for both the work at UCLA and at Public Health, we'd love to know that. So if you could leave your comments in the chat, and I'm just going to go check out the chat really fast. Sorry. It's kind of a trick in how to find everything when you're sharing your screen. I'm sorry, I can't see the chat. Can someone facilitate and maybe read out what's happening? Oh, here we go. So how might you be able to use the resources you saw in your work? Let's see. So, oh, wonderful. So someone added this resource to the Monterey Park Bruggemeyer Library's online consumer health resource center, and we'll share with community partners. Thank you. Are the resources modifiable to be able to use in other counties? Well, I'm sure, I think for DPH stuff, we would have to get permission, but I'm sure the content and everything is totally shareable. And I'm going to leave my contact information at the very end so that if you would like to contact me about further conversations, I'd be happy to. Anyone else want to share how they'll be able to use these resources or what can be improved? What are things that you saw that maybe could have been done better? What more would you want to see that's missing? We would love to know.
Well, people are responding to that question, to the prompt, just in response to Jeannie's question about resources modifiable. For all of the resources on the UCLA site, it says who it belongs to. So I think you just have to get permission from the actual owner of that or generator of that resource.
Right. So, oh, great. Wonderful. Our member CHCs are always looking for accurately and translated information, especially with the rapid changes in the needs of, I'm so sorry. Things are moving while people are chatting. resources regarding COVID, yes. So thank you for sharing on the APSHA website. Wonderful. Understand the material was presented without a date. For the DPH materials, they do actually have the revised date, and because we just very recently updated it, it has, I think, today's date on most of the ones that at least I highlighted. No.
For the UCLA resources, we chose not to put the date because the only date we had was the date we discovered it. And if there was a date to be known, it would have been on the resource itself. So there might be resources that do have dates included, but we didn't list the dates or any dates on the search results.
Got it.
Although the videos that we produced have a date on, at the end of the video.
Yes.
Thank you. Okay, I think we can move on to the next question. What should be included in messaging about COVID-19 vaccines? So for this one, we're really trying to get ahead of a lot of the misinformation that's coming out there. But what have you been hearing? What would be helpful for us to produce and translate for our communities? Where are people getting their messages from? All of these things we would love to get your feedback on. I think it's a great opportunity for in this space to have all of these Asian and Native Hawaiian Pacific Islander serving organizations to be all in one place. And we would love to hear from what you're experiencing on the ground and in our communities. They're safe, but it might help to have photos of trusted or known people getting vaccination. Great. Infographics that can be easily shared via social media platforms. Yes, absolutely. And hopefully, the resources that I showed with the county will help with that.
May I add, Jocelyn?
Of course.
So as I mentioned, we are part of the Vaccine Equity Committee. And so as part of that effort, we have really been trying to share information about our community's needs, where people are at. And so I want that message also to come across, which is that folks that are part of the community are advocating on behalf of community members, and that there are a number of organizations working on behalf of marginalized communities, those who are low income, those who are disabled, those who come from communities of color, et cetera, and really thinking of all of the variety of issues, because I know that unfortunately we do live in a time of real distrust of our governments, and not knowing, we get very mixed messaging sometimes, unfortunately. Obviously this is a new disease, and so there's so much that we don't know, but really that people are working hard to make sure this gets out to everyone in the most expeditious and equitable manner. And also, as has been said in the chat, and as you also mentioned, Jocelyn, is addressing the misinformation. We know that in addition to what's been out there sort of in terms of mainstream messaging, there also is specific misinformation on ethnic specific social media. So on WeChat and WhatsApp and some of the other social media vehicles. And so, if any of you see those, identify them, please let us know so that we can help in some of our communications work to develop the right responses, so that it's not just necessarily for the individuals or patients that come to your office or that you come in contact with, but for all of us across the county to be able to address that misinformation and also all of the questions that are out there.
Thank you, Manju. Let's see here. There's a flood of anecdotal social media. Sorry, I lost it again. that shares personal stories that get shared, maybe personal stories framed like a story a relative might share with someone. That's a great idea. Yes, distrust is understandable. Even healthcare workers, staff don't have high confidence in the current vaccine due to speed of the production and EUA, emergency use. What would be helpful are fact sheets about clinical trial process, production, testing, potential side effects versus myths. Great. Okay, someone is suggesting what folks in Hawaii are doing. Thank you for sharing that resource with us. Please keep it coming. We have one more question. We're coming up at time. Actually, this is our Q&A. We wanted to hear from you if you have any specific questions for us. And for this, you can actually put your questions in the Q&A section rather than the chat if you choose. And I will try and pull up the Q&A as well. It's sort of tricky for me. Let me actually stop sharing my screen.
I think the first question is for you, Jocelyn.
Is county working with other counties in the state to create similar AA and NHPI specific hubs or at the state level? From where I'm sitting with this subcommittee with the county, we have not been, but you bring up a very excellent point, and that we should be reaching out to our county partners, our statewide partners, to have a similar messaging. Why reinvent the wheel if we could share what's already been developed? I think that's an excellent idea. How did LA County determine what languages to provide info in? Was that based on county staff language capacity? This person works in the San Francisco Bay Area, and local government is sharing some info in required languages, but not all info is translated into all languages where there is need. We decided to translate into the Los Angeles County threshold languages, the Asian languages. So there are more languages actually than the ones that I had listed that are considered threshold. And it's some calculation with Medi-Cal, and I don't remember what the exact formula is, but it's the LA County threshold languages that are required for information to be translated in. I may have missed this, but with the rapid changes in COVID info, how fast are the turnarounds for the translations? That's a great question. So for us, and with this particular material that I highlighted, it's a fast turnaround for translation. So, of course, I don't know if anyone has been, to our website, and we have our health officer orders. A lot of our guidances, protocols are changing a lot, and so we have to produce the translations very quickly for just to be relevant, right? And then post them on our website. For our process, however, for the one pager that I highlighted today, it was a longer process because we wanted to make sure we got that community vetting, which is not a usual process for us. But the translation itself with our vendors, very quick. It's the trying to go back and forth and making sure that all of the translation is done correctly and according to what our community members think is the best way to impart that information. Really was a little bit time consuming, but I think totally worth it. All right. I'm not going to write them, so it's not going to show onto the answer tab. So hopefully I answered those folks' questions. We're coming up about 2 minutes, and what we wanted to do at the very end, thank you so much for everyone's participation, your just attention and just being here today. But we would like to close out with another video that was produced again with our Asian American Studies Center at UCLA, along with the Fielding School of Public Health. And I believe this one is on hand washing. Thank you, everyone, for your time. Oh, we're not hearing it.
Should I wear a mask or face covering? If someone has coronavirus, they can spray the virus into the air from their lungs by coughing, singing, sneezing, or just talking. The virus can travel more than 6 feet this way. If you breathe in the virus, you can get sick. Some people who have the virus don't feel sick or have symptoms, but they can still spread the virus without knowing it. In addition to washing your hands and keeping a safe distance from one another, a mask or face covering over the mouth and nose helps stop the spread of the virus to other people. When should I wear a mask? You should wear a mask when you leave your home, such as when you're walking around the neighborhood, shopping, at work, or if you must visit family. Even if you believe you are alone outside, keep the mask on because you may suddenly run into other people. How do I put the mask on? Choose a mask that fits snugly and comfortably. If one mask doesn't fit well, try a different kind of mask. Don't contaminate your clean mask. Wash your hands before putting it on and hold the mask by the straps. Make sure your mask covers both your nose and mouth, and it fits snugly on your face. It's important to keep your mask clean, so touch it as little as possible after you've put it on. 3 things to keep in mind. Don't pull the mask down below your nose or rest it on your chin. Don't use a mask that is damaged or cut slits in your mask. Don't share a used mask. Remove the mask when you're done using it. Your mask can get contaminated by the virus while you're wearing it, so remove it carefully. Be careful not to touch your eyes, nose, or mouth, and wash your hands immediately. Make sure you wash cloth masks with soap and water, or throw away disposable masks after each use. Caring is mask wearing. Wear a mask now to stop the pandemic. Based on scientific knowledge as of June 2020, the most common way to get the coronavirus is by breathing in respiratory droplets of those infected with COVID-19. Another common way of getting the virus is by touching your nose, eyes, or mouth after touching an item or surface contaminated by the virus. To protect yourself and others, wear a mask or face covering, wash your hands, keep a safe distance from others in public areas.